Hi, I'm Dr. Zach Winkelmann with Atlas Chiropractic in Billings, Montana. I'm located at 1510 24th Street West, and I can be reached at 534-8106, or you can visit me on the web at atlaschirobillings.com. Today I'm going to talk to you about a common symptom or complaint that I see very often, and some simple ways that you can help this on your own as well as getting chiropractic care. The symptom that I'm talking about, and I'm sure many of you have this or have had it in the past, is pain in the back of your neck that goes into your shoulders or in between your shoulder blades that may kind of radiate into your shoulder. A lot of people will wake up with this, or they've just had it for many years and they don't know what's going on. There's several things going on, but they can be fixed very easily with chiropractic care as well as some exercises. So in this upper cervical area, where many of people have the pain in this region here, first cervical, 7th cervical vertebrae as well into the thoracic, there's a few things going on. Number one, there's a change in the curvature of the spine. Your thoracic spine has a kyphotic type curve, and then your cervical spine has a lordosis. So right in between the 7th cervical and 1st thoracic vertebrae, there's a change in the curvature of the spine. So this particular area of the spine has a lack of motion. And what happens then is the rest of the cervical spine and areas around it pay for that. So the other thing that happens is look at people and their posture. Many people have what's called anterior head carriage. As you can see on the x-rays up here, I don't know how well you can see that, but notice how this person's spine just goes basically straight forward, and then there's this line drawn. This person's spine should follow that line. So when you're standing upright, your shoulders should be back, chest out, shoulders back, and your head should be held back so that your ear is right above your humerus head. If you look at many people, their heads are like this, and the further forward, the more degeneration issues they're going to have with the spine. Also, when your spine is forward, all the muscles in the back of the neck and between the shoulder blades begin to support the weight of your head, where the cervical curve and the spine itself is not. And so when this happens, you're going to get a lot of degeneration, you're going to get a lot of muscle pain and issues all the way into the neck and then into the shoulder blades. So anterior head carriage is causing much of the problem. So how do you fix this issue? Number one, come in and get adjusted. Getting this upper cervical area as well as this lower cervical area adjusted will get motion back in and get these bones back into the place they should be. The next thing is focusing on your posture and strengthening the muscles in the back of the neck as well as stretching your chest. So there's a number of things going on there when you have anterior head carriage. Many people have head carriage like this, and then their shoulders are slouched forward. What you want is you want your shoulders back, so your palms more out, and then you want your head back. So how can you do that? Again, get adjusted and then do some exercises. First exercise is you need to stretch your chest muscles. Pec major and a pec minor. Pec major is a big muscle here. Pec minor is a smaller muscle that comes down and connects to your ribs. So with the pec major, what you can do is you can lean against the wall and you can just really stretch into that. You want to hold it for 20 seconds, do it both sides, do it a couple times every single day. And then pec minor, get your arm up a little higher and then really lean in and get that pec minor. Now, the pec minor is a typical culprit for thoracic outlet syndrome as well, which is a syndrome that can cause numbness and tingling in the arms. Your thoracic outlet is an area where your subclavian artery as well as the brachial plexus goes to your arm, and if that area is tight and getting pinched, then it can cause numbness and tingling in your arm. So that pec minor is very important to get stretched out. It's hard to stretch because the pec major is such a large muscle, so you need to really lean into that, just like I was showing. Arm up top for the minor, down low. You can also go a little bit lower, but really lean in and get a stretch there. So what that's going to do is allow your shoulders to at least begin to be able to get pulled back. So then what do you need to do to strengthen the muscles in the back of your neck and shoulders? Number one, there's a few exercises. I call them the Y's, T's, W's, and L's. I don't know if you can see that. This is on my website, so you can check it out. They're simple exercises. I'll just go over them briefly now. But basically what I'm having patients do is take, in these different positions, take their arms and pinch their shoulder blades together so you can feel that burn between your shoulder blades. You see how I pinch that together? And then the next thing you want to do is bring your head back and keep your chin tucked. And if you've never done this, it actually is a lot harder than it looks. This will strengthen the muscles in the back of the neck as well as the muscles between your shoulder blades, beginning to pull those shoulders back. Now that you've stretched your chest, it'll pull those shoulders back, and then you'll have your head will begin to be held back as well. That will increase the cervical curve, getting motion back in with adjustments. This is going to cause you to get relief on a lot of these symptoms and very easily. So there's additional information on my website. Go check it out. I'll post these exercises as well as I give others at the time of the adjustment. Go into your chiropractor, get adjusted, and you won't have to deal with this nonstop, constant pain in the back of your neck and between the shoulder blades. And it's becoming more and more prevalent with people, just based on people looking at their cell phones. Their heads are down, their shoulders are forward. Work, sitting at a desk, shoulders are forward, head is forward. I have some welders, they're constantly with a mask on, their shoulders are forward. They have lots of issues in this area, and just by doing some of these exercises, it's given them a lot of relief, as well as getting the adjustments and getting motion back in that spine. So again, Dr. Zach Winkelmann at Atlas Chiropractic. My number is 534-8106, or you can visit me on the web at atlaschirobillings.com. Thanks for watching. Have a good day.